So we don't do kidney biopsy if the risk to the patient is more than the benefit of kidney biopsy. So what are the contraindications? The first and the foremost is if the patient has high uncontrolled blood pressure, we don't do the kidney biopsy because it can increase the risk of bleeding. Or if the patient has a problem with clotting, like if his platelet count is low, or if his hemoglobin is also very low, or if his PT-INR or bleeding and clotting time is elevated, we don't do kidney biopsy. If the patient is already on blood thinners or the drugs which prevent the clotting of the blood, we don't do kidney biopsy. Or if the patient has any infection of the kidney like pyelonephritis, we don't do kidney biopsy. And if the patient has abnormal shape of the kidneys, like some patients can have a shape of kidney like horseshoe, in that the anatomy is distorted so that we cannot do biopsy confidently and it can lead to complications. Or if the patient has multiple cysts or fluid filled cysts in the kidneys, without an area where we can do a kidney biopsy, where the area which we cannot see, then also we cannot do. Or if the patient has obstruction of the urinary outflow from the kidneys, like if the ultrasound is showing what we call hydronephrosis, then also we don't do the kidney biopsy. So these are the contraindications of the kidney biopsy. We will also not do kidney biopsy if there is any infection over the skin at the site where we will insert the needle. So skin infection over the kidney will also is a contraindication for kidney biopsy. And also if the size of the kidney is also very small, generally if the patient has a chronic kidney disease for longer duration, the damage will be irreversible inside the kidneys and the kidneys will shrink. So in these patients also we don't do kidney biopsy because the complications of biopsy in such patients are more and the information which we get from biopsy is also very less.